today we are going to introduce a very special guest speaker with us on this occasion of third international conference on World Mental Health Week. Today we have Honorable Dr. Olusei ma'am from Nigeria. She is head of research at Shelter NGO, national trainer at UTC, counselor, author, and life coach. Today, she is going to enlighten us with a very sensitive, important topic in the field of mental health, that is mental health and substance abuse. So, I would like to request ma'am to kindly proceed today's topic. And if anyone has any query or question, they can directly ask in the comment section during the live on YouTube. So, first of all, thank you so much, ma'am, for providing your valuable time. Now we can proceed.
Hello, everyone. Happy World Mental Health Day. This year's Mental Health Day is tagged Make Mental Health and Well-being for All a Global Priority. So this is what we are saying today. That mental health should be the priority of all. So today I'm going to speaking on mental health and substance abuse. Let's look at our session overview. We are going to be looking at understanding mental health, and we will look at characteristics of a mentally healthy person, types of mental illness, common risk factors for mental illness. We will also be looking at signs of mental issues, and thereafter we'll move to understanding substance abuse and the effect of psychoactive substances. We'll look at relationship between mental health and substance abuse. Thereafter, we'll look at how do we manage mental health disorders and substance abuse disorders. Now, what is mental health? Let's look at World Health Organization, how they define mental health. According to the World Health Organization, mental health is a state of well-being in which every individual realizes his or her own potential and can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. From this definition, we can see a lot there. Productivity, ability to withstand stresses of life, and also ability to contribute to our community whenever we are. Now we are going to look at some other areas of mental health. What mental health is, we want to look at it further. It's also the ability of an individual's mind to function in a way that enables him or her to engage in productive activities, going to work, take up employment opportunities, vocations or skills. Also have fulfilling relationship with others, that is ability to relate with people very well. Also, ability to adapt to changes. Sometimes there may be changes. There may be change of work, change of job, change of profession, change of career. There may be change of location. Ability to adapt to these changes. And also, ability to cope with adversity, to cope with stressful situations, unpleasant situations also. This is what mental health is all about. Now let's move further to look at characteristics of mentally healthy people. When people are actually mentally healthy, what are those things we should be on the lookout for? Number one, they feel good about themselves. They do not become overwhelmed by emotions. You know, we have different emotions such as fear, anger, love, jealousy, guilt, or anxiety. Also, they have ability to have lasting and satisfying personal relationships. They are comfortable with other people. They can relate well with other people, irrespective of any differences, maybe gender, religion, or tribe. They can laugh at themselves and with others. They have respect for themselves and others, even though there are differences. They respect other people's religion, other people's tribe, other people's uh, ethnic background, other people's educational background, other people's views, other people's opinions. These are some of the characteristics of mentally healthy people. They are able to accept life disappointment. Sometimes there may be disappointment in one way or the other. They are able to accept it and move on in life. Also, they have the ability to make their own decisions. They can look inward, look outward, look at circumstances around them and make decisions that are good for them at that particular point in time. Also, they can make their, they can adapt to their environment and adjust to it when necessary. Because sometimes there may be changes in the environment and they are able to adapt to it. So these are some of the characteristics of mentally healthy people. Now, we want to look at other things when we talk about mental health. Now we have seen what mental health is now. We know what mental health means. Now we want to look at mental illness. That sometimes someone may have issue with his mental health. What is mental illness? It's a condition that actually affects the way a person thinks, feels, and behaves, even their perceptions, the way they perceive things around them, their feelings towards people, towards things, the way they think towards issues of life is they have negative, it's negative towards them. Everything about this has a negative effect on them. Then we can say that this is that such an individual has mental illness. Now we want to look at some of the different types of mental illnesses. Some examples of mental illnesses, they include depression. Depression has to do with someone, excessive sadness and losing interest in activities. Some Another example is eating disorders. When people begin to have issues with eating habits, things that are not normal in that area. We also have schizophrenia, which is a condition whereby people lose feelings in touch with the reality. And also obsessive compulsive disorder, whereby people have excessive feelings towards something and also a repetitive behavior. We also have dissociation. It's an example of mental illness when people are disconnected with the realities of life. We also have general anxiety disorders when people have fear, excessive fear for different things at the same time. We also have bipolar disorder when people have like different, different, different outlook towards things. They can be very happy this time, but another time very sad. These are some of examples of mental illnesses that we have. Now let's look at other things about mental illness. What are the common risk factors for mental health problems? Risk factors has to do with what are those things that can actually predispose someone to mental health problems, that can increase the risk, the incidence of someone having mental health problems. Number one, family history of mental health problems. When an individual has that history of having mental health problem, is in the family, maybe it runs in the family, then the risk of having mental health problem is high. Also, another risk factor is complications during pregnancy or at birth. When someone is pregnant, some issues, some problem may actually happen in the womb that may predispose a child to having mental health problems. Or it may also occur at birth when a child is being born. For example, maybe prolonged delay in childbirth can actually result to mental health problems in a child. Also, personal history of traumatic brain injury. Our brains are very important. So when there's any injury in the brain, and that injury is actually traumatic, it could also lead to mental health problem. It could lead to mental health problems. And also chronic mental medical conditions such as cancer or diabetes could also be a risk factor for mental health problems. Another risk factor is use of alcohol or drugs. Any form of psychoactive substances can actually lead to mental health problems. Now let's move forward. What are the signs of mental health issues? Sometimes people that have health issues, they may feel so anxious and worried unnecessary anxiety and worries. It could be a sign of mental health issues. Yes, at one time or the other, you may be anxious, or maybe you may have reason to get worried. But when it's becoming excessive, then it could be a sign of mental health issue. Feeling depressed or unhappy, losing interest in activities that maybe someone has been having a positive outlook to in the past. Emotional outbursts. Someone may be having sleep problems, maybe too much sleep or even not sleeping at all. Weight or appetite changes is also could be a sign of mental health issue. Someone may be quiet, no, that is not actually the characteristics of that individual, or someone will feel withdrawn, not talking to anybody. It could be a sign of mental health issue. Feeling guilty or worthless. At a time, someone will feel so guilty, that, oh, maybe I'm the cause of this problem in my family, I'm the cause of this, feeling worthless, feeling, oh, why am I even in this world? What am I even doing? This could be a sign of mental health issue. Also, may have some, behaviors that are not really, positive. And substance abuse also could be a sign of mental health issue in an individual. Now, let's move forward. We want to look at substance abuse. We have seen that substance abuse is could be one of the signs of mental health problem. Now, what is substance abuse? According to the World Health Organization, WHO, substance abuse refers to the harmful or hazardous use of psychoactive substances, including alcohol and illicit drugs. So when some people begin to use substances in a harmful or that will be so that is dangerous to their heads. Such substances like psychoactive substances. Psychoactive substances are substances that actually affect the central nervous system, that is the brain and the spinal cord. Examples like alcohol, you know, like cannabis, and some other drugs, both licit and illicit drugs. That is when substance abuse could occur in, in that context. Now, let's look at effects of psychoactive substances on the brain. Like I said earlier, I said that psychoactive substances affect the central nervous system. And when we talk about the central nervous system, we are talking about the brain and the spinal cord. Now we want to look at effect of psychoactive substances on the brain. It affects the brain. And how does it affect the brain? It causes changes. The psychoactive substance causes changes in awareness, how how someone see the environment, thoughts, mood, feelings, behaviors, and perceptions. These are some of the effects of psychoactive substances on the brain. And sometimes it's going to depend on the type of substances or psychoactive drugs. Some of them can cause euphoria, that is being highly happy, being happy. Some can cause increased energy, can make someone to feel alert. Some can, you know, cause sleepiness, hallucinations, begin to see or feel or hear things that doesn't even exist at all. And we have different classes of psychoactive substances. I think I need to just mention some of them here. We have some are stimulants. They increase people's attention, increase their energy, and some are depressants. They decrease the activity of the central nervous system. And some are we have another class called hallucinogens. They actually cause people to begin to see or hear things that doesn't exist at all. Now let's look at mental health problems and substance abuse. Now we know, we have an understanding of what mental health problems are. And also, we now have an understanding of what substance abuse are also. Now, we want to look at these two together. Substance use disorder and mental health conditions are often closely related. How? One may cause the other, or they may occur at the same time. So, for example, substance use disorder can actually lead to some mental health conditions, and at the same time, some mental health conditions can also lead to substance use disorder. Or sometimes at the same time, two of them may occur in an individual. That is what we call comorbidity. That is, someone having substance use disorder and mental health conditions at the same time. Now let's look at relationship between the two, how the two can actually cause the other. So mental health problems and substance use disorders. Like I said earlier, mental health problems and substance use disorders sometimes occur together, sometimes, not always. Certain illegal drugs, I know it depends on a country. For example, in my country here, when we talk about illegal drugs, we talk about like cannabis, cocaine, they are illegal drugs. They can cause people with an addiction to experience one or more symptoms of a mental health problem. Someone taking any of these drugs, they begin to show some signs some people that are addicted to some of these drugs, they begin to show some signs of or symptoms of some mental health problems. Sometimes mental health problems can sometimes lead to alcohol or drug use because some people, when they have any mental health issue, they may think that by taking substance like alcohol or any drugs can actually help them out of the problem, and they may begin to misuse the drugs. Doing some it's like a form of self-medication without doctor's prescription, and as a result, they will begin to abuse substances. Sometimes also mental and substance use disorder, they share some underlying causes. And what are the causes of these two uh, two issues? Changes in brain composition can actually lead to mental health disorders and substance use disorders. Also, genetic vulnerabilities. For mental health disorders, gene can actually, genetic makeup of an individual can actually have, it could be a factor that we need to consider when we talk about mental health problems. And for substance use disorders, also research that 40 to 60% of addiction is genetic. That is, gene has a lot to do with substance use addiction. And also, sometimes exposure to stress or trauma can lead to mental health problems and also substance use disorders. Now, we have seen how these two are related, how one can lead to another. Let's look further and see other things about mental health problems and substance use disorders. How do we manage these two issues? How do we manage mental health problems and substance abuse disorders? Sometimes the best treatment for co-occurring disorders like this, that is, if they occur together, is an integrated approach. What do I mean by integrated approach? This is where these two problems are treated simultaneously. That is, at the same time. Look at substance abuse problem and also the mental health disorders and treat them at the same time. And what are some of the treatments for mental health problem? They may include medication, individual or group counseling, as the case may be, some self-help measures like like diets, exercise, and so on and so forth, depending on the kind of mental health problem that that individual is having. Another treatment for mental health problem could be lifestyle changes, changing of things that you used to do, things that can that can be positive when we look at that kind of issue that an individual is having, and also peer support, supporting each other in this issue, in this problem area. Also, when we look at treatment for substance abuse, this may include detoxification, as the case may be, managing or withdrawal symptoms. For substance abuse disorder, we need to take care of withdrawal symptoms because some of these substances, when an individual want to stop or reduce using it, they may begin to have some negative effect on their body. So taking care of withdrawal symptoms is very important when we talk about treatment for substance abuse. Also, behavioral therapy, support groups to help maintain your sobriety. So these are some of the treatments for substance abuse disorders. Now, we have come to the end of the presentation on substance abuse and mental health issues. We can also look further and check further and read further or, as this relates to these two topics via the references that are on the screen. Thank you for listening.
To move, we have few questions. Let's take a few of them. First one is, what are the ways to diagnose and know about mental health problems? How can we prevent it? Means, as we know, prevention is better than cure. So, what are the ways or what are the signs and symptoms that we can see or we can say that a person is dealing with mental health issues? And
We have many diagnosis instruments that can be used to actually diagnose mental health problems. It's not something anybody can just do. It has to be done by a specialist in this area. And how can we prevent it? There are many mental health issues, many mental health problems. For example, I mentioned depression, eating disorders, bipolar disorders, and so on and so forth. There are many things we can do to actually prevent it. For example, that of depression. Like depression is excessive sadness and loss of interest in activities. How can we prevent this? Is if there's any issue of concern to an individual, try to talk about it and take some self measures to actually you know, to sort it out. Because when an issue persists for some time, and also we need to remember there are some factors that could lead to any of these mental health issues. When we know about them, then we can prevent them. Like I said earlier, don't forget we have some risk factors for it. Family history of mental health issues. We have genetic vulnerabilities to it also, trauma. So if you are able to take care of all these risk factors, then we can actually prevent any of any type of mental health problems. That's what we can do to prevent it when we know all the risk factors and we now provide the protective factors. Because whenever we have risk factors, we also have protective factors. So when we are able to sort this out, Then,
So much, ma'am. And another question from my side is, what will be your advice, or what is, as per your experience, to the uh, emerging ones or the aspirants who wants to see a career in the field of mental health as a professional? So, what qualities should be there in that individuals, that aspirants of mental health professional, or we can say the students also, for going beyond, or for going in a better way to become we can say a unique mental health professional? What are the qualities you should, or everyone should see in him or her?
please, can you? I cannot hear you very well. Please, can you come again?
I just want to ask that, what are the qualities to become a good mental health professional? In short, if I want to say,
What does it? Please come again, please.
uh,
Come.
what should be the qualities to become a good mental health professional?
Okay, to be a good mental health professional, you have to start from training. Train to be train to be one. Different courses that we have different courses on mental health that you can do. Different courses and even in substance abuse. We have, for example, we have prevention curriculum. Can be trained on universal prevention curriculum, how to prevent substance and abuse. You can also train on treatment, universal treatment curriculum. Even we have URC now, that is Universal Recovery Curriculum. So training. That is how to become a better a better person in any area of your choice, either in mental health or in substance abuse disorders. Trainings. Education. That's how to become a better person.
Yes. Thank you so much, ma'am, and thank you again for your valuable time for the presentation, for enlightening us through your knowledge and experience. And we will definitely meet again with some new topic for enlightening the people. And before winding up today's session on this conference and on the occasion of World Mental Health Day, so what will be your conclude message to all the humanity?
My good message is from this year's World Earth Day that we should all make mental health a global priority, a priority for every one of us. Like I said earlier, when we're talking about human beings, we're not just talking about physical health because your mental health will affect your physical health. And look at the definition of what mental health. It has to do with every aspect of our lives. Your relationship with people, your physical health, you know, your contributions to the society. Because if someone is not mentally stable, if one has any mental illness, one will not be able to contribute to the society. One will not be able to maximize his or her potentials. So, to everyone out there, I want to tell you that mental health is very, very important. We need to take care of our mental health, and we should also avoid stigma. If someone is having any form of mental health issue, what that individual needs is help. We need to empathize with such individual and refer to the appropriate place where such people can actually get help and get that help early, because it's very important to get help early. Because sometimes in my own area, my own community, when people have mental health issue, people will just look at that person as maybe it has to do with one spirit or the other. But because if you don't take care of that issue on time, it may come to a stage where it will be very difficult to actually, for that individual to come out of it. So let's take our mental health very serious, very, very serious, because our brain and our central nervous system is in charge of every aspect of our lives. So mental health is very, very important. It should be everyone's priority, no matter your age, because we have seen even some children that have mental health issues. So it's not even about age. Even children, adults, boys, girls, male, female, they have mental health issues. The rich and the poor. So it's not about a certain set of people. Mental health is an issue that we need to actually, you know, take as a priority. That's why I really love this year's, what Mental Health Day tag or slogan. Make mental health and well-being for all a global priority. Thank you.
Thank you so much, ma'am. You mentioned very well that we should give importance to the mental health. It is not related to just age or any community or section of the society. It
Yes.
belongs to everyone. So everyone should take care of mental health and making it a global priority, making it a prime priority in our life, because whatever we are in our mind, whatever the status of our mind, it will be reflect in our life and the behavior too. So thank you so much, ma'am, once again for providing your valuable time on today's session. So with your permission, I would like to wind up today's session.
Thank you for having me. Thank you, everyone. Bye.